There are 850,000 people with dementia in the UK, with numbers set to rise to over 1 million by 2025. This will soar to 2 million by 2051. Over 60% of people with dementia are still living at home, often predominantly cared for by spouses or other family members. It is still a very misunderstood and feared condition, but one that is likely to touch all of our lives at some point. St Cuthbert's Hospice in Durham employs a dementia specialist nurse and also gained funding to offer an innovative community project for people with advanced dementia.
Hello, my name is Lisa Howarth. I'm the dementia specialist nurse here at St Cuthbert's Hospice. Today I'd like to talk about progression of symptoms with dementia and why Namaste care is needed. There's lots of research about the various stages of dementia, and I would like to talk you through the most common signs of early dementia through to the later or advanced stages. At first, people may talk about having memory loss and becoming more forgetful and difficulty in concentrating. This may affect people completing familiar tasks and getting confused over correct change when shopping, or forgetting how to use familiar household objects such as microwaves. People may struggle to follow conversations or find the right words when talking. They may also become confused about time and place and notice some changes in their mood. These problems are often mild and may get worse gradually. As they progress, the memory problems become more apparent and people start to regularly forget recent events, names and faces. They become more repetitive in conversation and find it more difficult completing tasks and activities, especially those requiring organisation and planning, such as preparing meals, medications and dressing. In later stages, memory problems are more pronounced and people may not recognise close family or remember where they live or where they are at. They will eventually become unable to walk and may need to use a wheelchair or become confined to bed. Some experience behavioural problems known as behavioural and psychological symptoms of dementia. These can include agitation, depressive symptoms, anxiety, restlessness and a desire to continue on the move and walking, aggression and sometimes hallucinations. Incontinence is common in the later stages of dementia and can affect both bowel and bladder. A person's appetite may decline and weight loss is common in the advanced stages of dementia, and the person may experience trouble eating and swallowing. This can at times be distressing to the person living with dementia and their families and carers, especially when they are reaching the advanced stages. At this stage, the later stage, Namaste care is needed. When you research dementia, you find information about living well with dementia, including support groups, dementia cafes, singing for the brain, cognitive stimulation therapy, and many more. These are all valuable in living well with dementia, but what is unique about Namaste is that when people are unable to get out to do these activities, Namaste and the volunteers come to the person's home and work on a one-to-one with the person.
Hello, I'm Nicola Kendall, the Namaste lead here at St Cuthbert's Hospice in Durham. Namaste care is a sensory approach to working with people in the advanced stages of dementia in order to improve their quality of life. Delivered by St Cuthbert's Hospice, a group of trained volunteers provide meaningful engagement and sensory stimulation to those living with advanced dementia in their own homes. We support people who can no longer easily express who they are or care for themselves without assistance. Spending time with family finding out about the person's life story will then inform the kinds of activities that the volunteers offer the person living with dementia. People with advanced dementia often can't communicate verbally with us in the way they once did, but we can adapt how we communicate with them in order to acknowledge their changing needs. Namaste care enables us to continue to connect with the person with dementia at a time when they can seem lost to their family.
My name is Peter Thompson, and I responded to an article that I saw in a local newspaper. I think it was about 2 years ago, and there was a certain process we had to go through. But I've sort of been on board with Nicola for about 18 months now, and I suppose during the last 12 months or so, that's when I've been doing visits and supporting people with the medical condition of dementia. Nicola and potentially one of the volunteers will have gone along to see the family concerned and do an assessment. It's a life history of the background of the individual, and that would identify what their employment history was, what leisure interests they had, and that sort of thing. And from that you can develop maybe music that they like, or touch things that they might have worked with, materials and so forth, and smell. So there's a whole range of things that it's important to try and associate their past with at the present time. I was particularly interested in making a contribution to society or my local community by getting engaged and trying to do something positive with my retirement time.
My name is Dr. Sonia Delgin, and I'm a Senior Lecturer in Public Health and Wellbeing at Northumbria University. I'm also a member of Hughes, which is the Centre for Translational Research in Public Health. I've been doing some research on Namaste, which is an intervention for those with advanced dementia. So as dementia progresses, often care focuses on the physical needs of the person, such as feeding and hydration. But people with dementia need more than physical care. They also need a quality of life. Our first finding was related to social interaction. We found that social interaction was actually a very important part of the intervention. So the Namaste volunteer would spend 2 hours every week with the person with dementia. And having somebody else to spend time with them was really valued by the person with dementia's friends and family. Often family carers felt like they did a lot of the personal care for the person with dementia, and they also had little input from other services. So when the Namaste volunteer came to visit, they would use that time for respite, and they would stay within the house. So they would maybe go in the garden or go on the computer, and they found that this was really useful. So there was positive outcomes for the person with dementia and also for the family members. Of course, if family members did want to join in the Namaste session, they were always invited to and always encouraged to.
As a community, we can come together and show that we care by improving our understanding of how to meet the needs of people with advanced dementia. It could be your parent, your neighbour, your friend. All they need is love and compassion.